One of the main areas of improvement in spine surgery is to minimize our injury to the patient to get the job done that we need to get done. And so this technique and this philosophy has come to the SI joint fusion now. As an orthopedic surgeon, I like screws. And when I saw the SImmetry system from Zyga, that made a lot of sense to me, that we could place a screw across a joint to provide stability. But what really made the Zyga system or the SImmetry system stand out was the ability to percutaneously enter the sacroiliac joint, effectively decorticate the cartilage surface from the sacroiliac joint in a relatively wide swath, and then place bone graft materials. We all know the problem of trying to do a fusion if you don't actually get the bones to fuse on a mobile segment. Spine surgeons hate it when we see halos around our screws in the spine or elsewhere in the body for fixing fractures. And we know that that's going to happen if you don't get a fusion of the joint. So the SImmetry system allows you to enter the joint and actually do a fusion of the joint. And the screw fixation then is temporary. It doesn't have to be long-term. It's temporary until the bone effusion occurs, and then the stress is removed from the screws, and they're not going to get into trouble over time, like I have seen some of the other systems that don't use screw fixation or don't actually fuse the joint. So I now have the ability to help a whole group of patients that I just didn't know what to do with previously. Now with the minimally invasive percutaneous technique to get a true sacroiliac joint fusion is just very gratifying. And these patients are very grateful.